up, I was very interested in emergency medicine. My father was an EMT for over 30 years. I got to see him on scene a lot of times growing up. He was also kind of the athletic trainer of our high school. I went to a very small high school, so I watched him handle a lot of the sports injuries there. So between the two, I knew I wanted to go into medicine, wanted to favor more sports medicine. With an athletic background, I wanted to stay with an athletics at some way. And then researching all my options, I liked physical therapy the best. The thing I love about what I do is it's both a blending of passive and active modalities. If somebody has an acute injury, we can use the tools, the ultrasounds, lasers, and stimulations to calm the inflammation. Right away, typically we'll also do things that are more passive in nature, joint mobilizations, massage, whatever it is to calm that area. But then after that, once the person is able to move that area, we teach them how to move, so that way we can, one, treat the area, but even more importantly, avoid that happening again or prevent other injuries from happening. So it's a blending of both the active and passive modalities that I like. On a very simple level, there's a patient right now that I'm working with where her back pain has been progressively worsening over the last 20 years. And something as simple as bending over to change her cat litter was something she dreaded every day. And now it doesn't. 20 years worth of back pain, and something as simple as changing cat litter doesn't hurt anymore. That's on a small scale level. Co-treating with one of the other chiropractors here, we just treated a gentleman who was, again, in pain for over 20 years. He's a pilot with a lot of neck pain. That's a problem when you're flying. And so, through compensation, he started developing a little back pain as well. He woke up the other day and said that's the best he'd felt in over 20 years. But again, I think that's just speaks volumes as to how the blending of the profession should work. Chiropractic care is teaching him and getting his spine able to move in the right way. And then the active piece of what I'm doing with him is teaching him things he can do to both treat himself, but also more importantly, prevent it from coming back. On that first assessment with somebody, whether it be a formal evaluation or somebody just wants to come in and maybe calm their fear of physical therapy, I think that trepidation or fear of physical therapy comes with a lack of understanding. The stories that you hear where people hurt with physical therapy is typically because something wasn't caught early enough, so you have to be aggressive to get a joint to move because it's stuck. I think we're better as an overall medical society where we do catch things faster and that happens less. If you teach somebody early on that they need to move, whether it be post-surgical or not, we can usually avoid that very painful situation where, again, through great education and then having them do things on their own, we can avoid the painful parts of physical therapy. We don't offer an ego, and that's a big thing. Politically, chiropractors and physical therapists have bashed heads since the beginning of both professions, I think. And as a physical therapist, chiropractors tend to protect what they do the most, right? So if a physical therapist wants to be able to treat somebody using manipulation, politically that's been a battle. Or the opposite, if a chiropractor wants to treat somebody with rehabilitation, physical therapists are going to fight that. What you find here is both experts working together. I do joint mobilizations, but I'm not an expert at that. That's not what I went to school for. That's a part of what I do. Chiropractors, that's an expertise of theirs. That's what they do. So if I meet somebody that I think could benefit from that, why not have them see the expert in that? And then likewise the opposite. If the chiropractors have somebody that needs an expert professional treat them through rehab, they send them to me. So that's what you get here is both experts working together, as opposed to somebody out of house saying, I can treat you all because they think they can. Come to us, we're better. You get the expert in each individual field looking at you.